Let's review a new government publication that will be a valuable resource for anyone interested in wellness. National Prevention Strategy, America's Plan for Better Health and Wellness, published in 2011 by the National Prevention Council. So who is the council? It was chaired by the Surgeon General, Dr. Regina Benjamin, and was comprised of secretaries for all the departments of government, including the Departments of Labor, Justice, Defense, Homeland Security, Transportation, Agriculture, Education, and the VA, and the heads of the EPA, FTC, Domestic Policy Council, and the Office of Management and Budget, among others. Their goal was to develop a plan for better health and wellness based on the top health concerns of the U.S., addressing these concerns through a strategy of developing healthy and safe communities, providing better access to clinical and community preventive services, empowering people to take charge of their health, and moving toward eliminating health disparities for underprivileged or otherwise disadvantaged individuals. They created the strategy's 7 priorities based on what the literature indicates are the top health concerns in the U.S. These are tobacco-free living, healthy eating, active living, preventing drug abuse and excessive alcohol use, injury and violence-free living, mental and emotional well-being, and reproductive and sexual health. Each of these priorities is given a small chapter that follows the format of providing a general overview statement, key facts, and a section on what can be done with specifics for the federal government and partners such as local and state governments. We'll focus on the most relevant of these 7 priorities as they relate to chiropractic practice. Given this is a 120-page document, our attempt is to use the key facts sections as a way of illustrating important issues through statistics that you'll find likely distressing but motivating to encourage and support lifestyle changes for your patients, and to get active in your communities to assist in broader changes. Healthcare is expensive, but in part this is because of those who do not adopt healthy habits. The annual healthcare costs are $2,000 higher for smokers, $1,400 higher for people who are obese, and $6,600 higher for those who have diabetes. Let's look at what living with good healthy habits can do to health costs. A 1% reduction in weight, blood pressure, glucose, and cholesterol would save $83 to $103 per year in medical costs per person. Part of healthy living is incorporating a prevention approach. There is good data on what to pay attention to based on age and gender. Yet for seniors, less than 50% are up to date on suggested clinical preventive services. Here's an example of that effect. For colorectal cancer, the second leading cause of cancer-related death in the U.S., evidence suggests that if screenings were implemented at recommended levels, more than 18,000 lives could be saved each year. $3.7 billion could be saved annually in medical costs by increasing the use of preventive services to 90% of the recommended levels, and medical costs could be reduced by approximately $3.27 for every dollar spent on workplace wellness programs. Prevention is economical. Much of the work of this panel focused on inequalities and their effect on health. One strategy is simply to set a priority for increasing educational opportunities in the U.S. Why? Education is associated with living longer, experiencing better health, and practicing health-promoting behaviors such as exercising, not smoking, and getting checkups and screenings. Racial differences are also apparent as disparities that lead to higher rates of death with some specific causes. Coronary heart disease and stroke are the most significant conditions that represent the inequality in life expectancy between whites and blacks. An inequality not so obvious at first glance is that chronic conditions are more common in rural areas, and individuals are less likely to receive recommended preventive services such as cancer screening and management of cardiovascular disease. Preventive care sounds expensive in the short term, so what would motivate businesses to encourage these types of programs? Cost savings. It's been shown that prevention increases productivity and can help avoid the hidden costs estimated for disability, time off work, and lost productivity, equaling 2 to 3 times the cost of direct medical expenses. Asthma, high blood pressure, smoking and obesity each reduce annual productivity by between $200 and $440 per person. Compared to workers without diabetes, workers with diabetes average 2 more absent workdays per year. For every dollar spent on workplace wellness programs, it's estimated that $2.73 are saved in absenteeism costs. Research from the Milken Institute suggests more than $1 trillion annually could be gained in labor supply and efficiency by only a modest reduction in avoidable risk factors. Let's move on to specific concerns and some key facts. Each year, asthma costs the U.S. about $3,000 per person in medical expenses, missed school and work days, and early deaths. There are over 12 million asthma attacks annually. Home visitation programs that focus on reducing exposure to triggers and better self-management have been shown to be highly effective. Disparity among groups is at play here too. Low-income and minority populations are at increased risk of being exposed to pollution and faced higher risks for asthma. Now on to smoking. Each year in the U.S., cigarette smoking is responsible for approximately 443,000 deaths and costs about $96 billion in medical expenditures and $97 billion in lost productivity. Although brief, consistent counseling by a healthcare professional is effective in helping people quit smoking, less than 20% of current smokers report cessation counseling at their last office visit. 11% of Medicaid costs and nearly 10% of Medicare costs are related to smoking. Screening for smoking is estimated to save $9,800 per person over their lifetime. Although there has been a decline in smoking rates over the last 40 years, this decline has stopped, with currently about 1 in 5 adults smoking. Smoking is more common in those who live in poverty, live with mental illness or substance abuse disorders, have less than a high school education, or work at jobs that primarily involve physical labor. Every day, of the nearly 4,000 young people who try their first cigarette, 25% will become daily smokers, with 90% of adult smokers having started before the age of 18, many of whom had parents that smoked. Whether someone smokes or not, more than 25% of the U.S. population and more than half of children are exposed to secondhand smoke on a regular basis. So some good news. Heart attacks among non-smokers have decreased approximately 17 to 19% as a result of smoking bans in workplaces, restaurants, and other public places. Let's address alcohol abuse. Alcohol abuse is one of the leading causes of preventable death in the U.S. regardless of age for adults. This results in more than 79,000 deaths per year. Approximately 30 people die in the U.S. every day in motor vehicle crashes that involve a drunk driver. The alcohol-related death rate for American Indians and Alaska Natives is 6 times national average. Here's some interesting facts that may surprise you about binge drinking. Most Americans who binge drink are not dependent on alcohol. Although 50% of adult alcohol consumption is binge drinking, 90% of youth alcohol consumption is binge drinking. Drug abuse. 6 million children live in a household where at least one parent abuses alcohol or other drugs. Children of parents with substance abuse problems are more likely to experience all forms of abuse and neglect and are more likely to be placed in foster care. Although alcohol is associated with many motor vehicle accidents, other drugs are detectable in approximately 18% of motor vehicle driver deaths. Yet there is a new face of drug abuse. In the U.S., prescription drug abuse is the fastest growing drug problem. Each month in the U.S., approximately 5.3 million individuals use a prescription pain reliever for non-medical reasons. Emergency department visits have doubled over the past 5 years for those who either misuse or abuse pharmaceutical drugs. Now on to a health crisis in the U.S. and surfacing in other countries: diabetes. Diabetes is the leading cause of heart disease, stroke, blindness, kidney failure, and non-traumatic related lower extremity amputation. For diabetics, keeping blood pressure under control is the single most effective approach for reducing the risk of cardiovascular disease by 33 to 50% and the risk of microvascular disease by approximately 33%. Did you know that 1 of every 5 U.S. healthcare dollars is spent on caring for people with diagnosed diabetes? Yet diabetes is almost entirely preventable. It's been shown that people who increased physical activity to 2.5 hours a week and had 5 to 7% weight loss reduced their risk of developing type 2 diabetes by 58%, regardless of race, ethnicity, or gender. A related concern is cardiovascular health. Look at the savings possible by addressing some of these issues. A 5% reduction in the prevalence of hypertension would save $25 billion in 5 years. In the U.S., less than 50% of individuals with hypertension have controlled their blood pressure, and only 33% with high cholesterol have it adequately controlled. Cardiovascular disease equals 20% of medical expenditures in the U.S. and 30% of Medicare expenditures, so clearly this is an area in need of prevention, if only from a financial perspective. One simple aspect is salt. Dietary sodium is linked to hypertension and is a primary risk factor for cardiovascular and renal diseases, including kidney stones. Americans consume more than twice the recommended average daily sodium intake. In the U.S., 80% of dietary sodium comes from packaged, processed, and restaurant foods. It's been calculated that by reducing average sodium intake to 2,300 milligrams per day, $18 billion in healthcare costs could be saved every year. Certainly related to diabetes and cardiovascular health is healthy eating. It probably won't surprise you that fewer than 15% of adults and 10% of adolescents eat recommended amounts of daily fruits and vegetables. And the obvious external consequence of not eating healthy? Greater than 66% of the adult population in the U.S. is overweight or obese, with projections from the recent census predicting as high as 75% in 5 years for males. What is shameful and inexcusable is that approximately 20% of children are overweight or obese by age 6, and over 50% of obese children became overweight at or before the age of 2. Over 23 million people, including 6.5 million children, live in what has been termed food deserts, but have an overabundance of fast food restaurants and convenience stores. Onto a problem that can be decreased significantly with simple reminders: food-borne illness. Annually, food-borne diseases cause 48 million to get sick, 128,000 to be hospitalized, and 3,000 to die. Reducing food-borne illness by 10% would keep about 5 million Americans from getting sick each year, and all they need to do is simply wash fruits and vegetables and thoroughly cook meat. Our focus as a society has been shifted to sedentary activities, especially for our children. How many opportunities are provided for daily physical education in our school systems? 4% of elementary schools, 8% of middle schools, and 2% of high schools. Currently, only 13% of children walk or bike to school, compared to 44% who did so in the prior generation. No surprises with this next statistic. 40% of adults and 80% of adolescents do not meet the physical activity guidelines for Americans. So what are some recommendations? Engage in at least 150 minutes of moderate intensity activity each week for adults, or at least 1 hour of activity each day for children. Supplement aerobic activities with muscle strengthening activities on 2 or more days a week that involve all major muscle groups. Consider following the American Academy of Pediatrics recommendations for limiting TV time among children. Did you know that the average 8 to 18-year-old is exposed to nearly 7.5 hours of passive screen time every day, watching television, videos, computers, smartphones, and playing video games? More than a quarter of trips made by car are within 1 mile of home. Physical activity levels are lower in low-income communities and among racial ethnic minority children, due in part to people feeling unsafe in their communities. Activity levels decline with age despite physical and emotional benefits. Physical inactivity is a primary contributor to two-thirds of the adult population being overweight or obese, and 1 in 6 children and adolescents being obese. It's encouraging that there is a national concerted effort to emphasize the need for prevention and to determine the resources to support such an effort. This document contains success stories as examples that you'll find uplifting. Some may provide examples of how you can help in your community. So what is the government asking you to do? Find ways to encourage healthy living in all your patients. A simple approach is to download the Agency for Healthcare Research and Quality document that contains the recommendations for preventive screening by the U.S. Preventive Services Task Force. Hand this out to all new patients and enlarge and post in your treatment rooms for the patient to review while waiting. The link to this single-page graphic is available on the home page of this video. At the top of the graphic are 3 directives: be tobacco-free, be physically active, and eat a healthy diet. Below that are the recommendations for screenings based on age and gender. These 3 directives are the cornerstone for most of the recommendations made in the National Prevention Strategy document. Remind the patient to stop smoking and provide resources to assist them. This constant attention has an effect on 6% or more of smokers. Remind them that smoking, in addition to lung cancer, is a cause of asthma, chronic bronchitis, and emphysema, and is an independent risk factor for disc herniation. Remind your patients that exercise has been shown to improve depression, hypertension, diabetes, and likely prevent many chronic musculoskeletal problems. Remind them that eating a healthy diet together with exercise will ward off diabetes or improve it if they have it. Simple changes such as decreasing sodium can have a dramatic effect on hypertension. And finally, as uncomfortable as it may be, remind patients to lose weight if necessary. If they follow the advice of exercise and healthy diet, weight loss will occur as a byproduct. Strongly encourage parents to set a healthy example for their children. Do your part and your patients will only respect you more. They will likely live a healthier, happier life, and that's what we're here for.